Well, welcome to another edition of Recognize Your Greatness. I'm Sean Taylor, and today, as you know, it's been that scruffy month of November where it's No Shave November, prostate cancer awareness for men. And today I'm with a very good friend of mine, and matter of fact, this gentleman takes care of me, ladies and gentlemen, PA Juan Moreno. Juan, welcome. So here's the question, ladies and gentlemen. Men don't like to talk about prostate, let alone prostate cancer. I wanted to bring Juan into the conversation because he's really at the forefront here at Baylor College of Medicine, Department of Urology, big up to Baylor, for really doing cutting edge type treatment. First, three things. What is actually PSA? What does that actually mean?
PSA is a blood test, a simple blood test that we use to screen for prostate cancer. There's certain levels, and a lot of the levels are usually age dependent. But the PSA is a tool that we use to give us kind of a risk assessment for prostate cancer and make a further decision pending on further individualized decision depending on patient's health, depending on their age and comorbidities.
Okay. And so once you get the PSA number, there's two ways we can go from having a conversation with you before. We can get a biopsy and find out if there's something happening within the prostate, but there's a newer technology that's non-invasive, and it's the MRI imaging. Share with us a little bit about how that has changed the comfort level of men being able to come in and get tested.
Well, pushing a little bit further back, if the PSA is above the normal levels, then we have a discussion with the patient to see what could cause the PSA to be elevated. Because the PSA can be elevated either due to a really large prostate or prostate inflammation from an infection. But if those two things are ruled out, then we have an increased suspicion of prostate cancer, then the next step typically would be to get a biopsy of the prostate. But understanding where the prostate sits anatomically and understanding doing a biopsy in an area that's not clean puts you at risk for infection. So nowadays we've learned to use MRI technology to improve our assessment of the prostate and give us a better idea whether there's a higher risk or lower risk of having prostate cancer.
That technology has changed my life personally. I've had two. So far, they've been clean. So, knock wood, I'll keep moving forward with that. Last question. What advice would you give to men in 2025 moving forward as pertains to prostate health and just overall health?
Well, at the end of the day, there are a couple of factors. One's genetic. So, understanding your family history is really important, especially with African American men. If you have a family history of prostate cancer, you're at an increased risk of that happening to you.
I've heard
also,
that, yes.
Understanding, the age of your family member had the prostate cancer. But then the other one is environmental. Certain diets, being overweight, not having good health status will affect you negatively in either being at higher risk for cancers in general, but also, if you need a treatment for, let's say, prostate cancer, not being physically healthy can affect the treatments available for you and the ability to recover from these treatments. So at the end of the day, having a healthy diet and exercising every day will help you in the very long run.
Juan, thank you for taking a few minutes with us. The work that you're doing is absolutely incredible. And at the end of the day, ladies and gentlemen, all my men out there, take care of your health, take care of your health, take care of your health. I'm Sean Taylor for Recognize Your Greatness.